Hi, my name is Kenneth Meier. I'm a student at Nevada State College, and this video is for Nursing 410 Physical Assessment. This will be a GI assessment video that I'll be conducting for this assignment. Again, my name is Kenneth Meier, and my patient, her name is Tina. And she's allowed me to assess her GI area today. So I've washed my hands and I've introduced myself to the patient. I'll just be asking her brief questions regarding medical and family history. I'm then going to inspect her abdomen. And then I will auscultate her abdomen, all four quadrants. I'll then be percussing all four quadrants, and then I will palpate all four quadrants as well, and that will conclude my GI assessment. So let me begin. So Tina, do you have any current or past medical history of any type of gastrointestinal problems or any type of issues?
No.
When was your last bowel movement?
This morning?
Okay. Are your bowel movements, are you having any issues with your bowel movements? Are you regular?
Yes, I'm regular.
Let's see. Are you having any abdominal pain, any type of nausea or vomiting, any diarrhea? You're not having any type of issues going to the bathroom?
No.
Are you urinating okay?
Yes.
Any type of indigestion or heartburn?
No.
Have you had any significant weight loss or weight gain within the past couple months?
No.
Okay. So that will, and what about any type of family history of any type of gastrointestinal issues?
No.
All right. So that will conclude my medical and family history portion of the assessment. I'm going to start off by inspecting my patient's mouth and checking her oral mucosa, looking for any type of sores, any type of abnormalities. So let me take a look at your mouth. Stick your tongue out for me. Okay, everything appears to be normal. Oral mucosa looks good, no sores. It's pink, moist. Alright, so we'll move back to the abdomen. So upon inspection of the abdomen, the contour of the patient's belly looks nice and it's rounded. It's symmetrical, equal on both sides. Umbilicus is centered. No visible rashes or any type of bruising. I don't see any masses or any hernias. No scars. Okay, Tina, I'm going to have you just sit up for me really quick, but just using your arms. Flex your abdomen. Do you have any pain?
No.
No? Okay. Go ahead and lay back down. Thank you. Alright, so now I'm going to auscultate my patient's bowel sounds. I'm going to start in the right lower quadrant and work up to the right upper quadrant, then over to the left upper quadrant, and then back down to the left lower quadrant. Vowel sounds are present in the right lower quadrant. Vowel sounds are present in the right upper quadrant. Vowel sounds present in the left upper quadrant. And vowel sounds are also present in the left lower quadrant. I'm now going to listen over the aorta area for any type of bruits, and then I'm going to move on to the renal artery and the iliac artery. The aorta is located about 5 centimeters above the umbilicus. Renal arteries are about 5 centimeters above the umbilicus, and then 5 centimeters to the left or to the right. And your iliac arteries are 5 centimeters to the left or to the right of the umbilicus. So I'll start with the aorta. I'm going to use the bell of my stethoscope. I don't hear any bruit there. So now I'm going to move to the renal artery. No bruit heard. Next, I'm going to move over to the iliac artery. No bruit heard either. I'm going to now move on to percussion of the abdomen. I'm going to start in the right lower quadrant. And work my way up to the right upper quadrant. And now I'm going to percuss the spleen, which is on the right side. So that's a dull sound, so the edge of the liver I can hear, and doesn't seem to be anything abnormal there. I'm going to now percuss the spleen. The spleen is between the 9th and 11th intercostal space. Okay, so that's good as well. So just to recap, spleen is in the right upper quadrant area. Then you have the gallbladder below it. Appendix is generally in the right lower quadrant. Spleen in the left upper quadrant, followed by the your sigmoid colon in the left lower quadrant. Okay, I'm now going to palpate my patient's abdomen, and I'm going to lightly palpate. Does that hurt when I do that?
No.
Okay. No masses or anything. I don't feel anything. No type of protrusion or anything when I palpate my patient's abdomen. I'm gonna palpate the spleen. Sorry, I'm going to palpate my patient's liver. All right. Now I'm going to see if I can palpate the spleen. Okay. I'm now going to palpate the kidney. And that's generally done. I'm going to hook her right side and then press. Okay. Same on this side. I felt that. All right, and that will conclude my GI assessment. Thank you very much, Tina.